Peripheral arterial disease, what we frequently abbreviate as PAD, generally means the hardening and narrowing of the arteries in our legs. PAD, or peripheral arterial disease, generally has a couple different reasons why it can happen. Some of it is genetic, so passed down from family members. Some of it is environmental or behavioral, so smoking is a big risk factor. And some of it is related to activity and diet. One of the first symptoms that patients will see is something that we call claudication, which is a fancy term to say pain when you walk a certain distance. And that pain can be described as cramping, burning, calf weakness, and it generally happens every time you walk that distance and goes away after you rest fairly quickly. That's a very typical early sign of PAD, or peripheral arterial disease. Before I get into that, what I'm going to talk to you just really quickly about is what happens when you come into the office with complaints of PAD. So if you come into the office and you have typical complaints, pain, walking a certain distance that goes away with rest, what we'll usually first do is obviously do a physical exam, feel for your pulses. A lot of time patients with PAD, they have weakened pulses or no pulses at all. And usually you'll get sent for an ultrasound to check and see what the degree of PAD you have is. Once you come back and see us, we review those results. Sometimes we'll get additional imaging like a CAT scan to give us more anatomic information. And then after that, we talk about treatment options. And so generally one of the first treatment options that we offer is endovascular, and that just means minimally invasive. We go in with an IV, and not only are we able to interrogate or diagnose your PAD, but also treat it at the same time with balloons and stents and roto-rooters and things like that. One of the unique things about VIVA is that we offer endovascular procedures like angiograms here in the office, which I think is very advantageous because patients can come, there's very little delay, the staff is fantastic, and all the things that you need to have done are done in one place, including your follow-up, short recovery period, and then you just walk downstairs and go home. So I think the ease of care here at VIVA is one of the unique characteristics of our practice.